What happens to the food and sweet that we eat? When we eat, our body breaks food down into sugar or glucose and send it into blood. Insulin is secreted by pancreas into blood. Although there is always a low level of insulin secreted by pancreas, the amount secreted into blood increases as blood glucose increases. Insulin then helps move the sugar from the blood into cells by having an effect on cells including muscle cells, RBCs, and fat cells. In response to insulin, these cells absorb glucose out of blood and thus lower the high blood glucose level into normal range. When sugar enters our cells, it is either used as fuel for energy right away or stored for later use. Another hormone, glucagon, also secreted by pancreas when blood glucose level is low, such as between meals and during exercise. The effect of glucagon is to make the liver release the glucose it has stored in its cells into bloodstream, and as a result blood glucose level increases. Why blood sugar increases in stress, sadness, and anxiety? When we experience stress, that can be emotional stress, infection, and serious illness, our brain releases stress hormones called cortisol and adrenaline that prepare our body by ensuring that enough sugar or energy is available. High cortisol level causes the pancreas to decrease insulin secretion and at the same time causes the body tissue to be less sensitive to insulin so that no glucose is absorbed into cells. Meanwhile, increased level of glucagon and adrenaline acts on liver, stimulating it to release the stored glucose. As a result, more glucose is released from liver into bloodstream. As a net effect, glucose level rises in bloodstream. Chronic stress is a great risk factor for type 2 diabetes.